gastroscope, right? Just listen, please. No need to write. Just listen. Gastroscopy is a topic, and that is given on page number 33 in your book. Now, the first question is, what is gastroscopy? What is the meaning of gastroscopy? Actually, let me explain. Let me explain. Gastroscopy is a process. Gastroscopy is a procedure. Okay, and in this procedure, an instrument is inserted, is put inside the patient from the passage of mouth to its stomach. This is a process in which an instrument is inserted from mouth to its to his or her stomach, right? This is a procedure, and this procedure is known as gastroscopy. Now the question is, what is the main function of gastroscopy? Actually, gastroscopy helps us to know the thickness of the stomach. It can help us to find out the problems which are inside of the stomach. How does it work? Actually, it works like this one, that when an instrument is inserted from mouth to the stomach, then on the computer screen we find the situation of the stomach inside, right? Because there is a pipe, long pipe, that goes from mouth to the stomach, and on the other side of the pipe there is a camera. And when camera, which is on the other end of the tube, when it goes inside, so it gives a picture. It gives a picture outside of the body, and then I think a person's stomach condition can be evaluated. It can be known here. So this is a procedure, and you know that procedure is the name of ijra. This is a procedure, right? And even you know that what is the meaning, what is the main purpose of gastroscopy. As I told you earlier, the gastroscopy is a name of procedure, and the main purpose of gastroscopy is to know, to diagnose, okay? Diagnose the sick condition of the stomach. And it is carried out when when a tube is inserted from mouth to the stomach, and then I think the picture of that interior condition of the stomach is seen on the computer screen outside. This is a procedure, right? Clear. Now, the other question is that what is endoscope? Actually, endoscope is a machine. Endoscope is an instrument, and in Arabic we call this is ala. This is a machine, or this is ala, or you may say that this is a jahaz, right? And as I told you that this machine or this instrument has a camera. It has a long pipe, and just on the other end of the pipe there is a small camera, and then it goes on. It goes inside the stomach, and then it tries to help out then what is inside there. Even if you want to see the picture of this machine, you can find that on page number on page number 29. If you want to see the picture of this machine, 29 page is there, and you see. Yes, on page number 29 we find that there is a machine, and and it goes inside of the patient's stomach, and finally we find out that if there is any sickness, if there is any problem, then this machine helps us to diagnose the condition of patient's stomach, right? So this is a machine here. So endoscope, as I told you, that endoscope in fact is a machine. This is a kind of instrument. And you have seen the picture of this machine there, right? It is given on page number 29.
What's the difference between endoscope and gastroscope?
Endoscope?
Endoscope and gastroscope.
Very good, no problem. Gastroscopy is a name of procedure. Ijra. And with the help of endoscope, gastroscopy is carried out. Gastroscopy is a name of procedure. Procedure. It is known as. It helps us to know the diagnosis. It helps us to know the sick condition of the stomach there. And endoscope is a machine. It's a machine. It is used in that procedure. Clear, Ahmad?
Yes.
No problem, huh? So endoscope you have seen here. Now let's see here. Now question number 3 here. What preparation is needed before gastroscopy?
Don't eat it.
Yeah. Very good. Exactly. If you want to go to have a gastroscopy procedure, then usually doctors advise you that don't eat anything before 4 to 6 hours.
Maybe 8 hours.
Yeah, okay. Yani in our book, they have given us that from 4 to 6 hours, any patient is not allowed to eat anything because stomach should be empty.
Yeah.
Okay. But in case of necessity, only a few sips of water can be taken. Rashfa moya. Only a few sips of water can be taken, even if it is, a very serious need of it. Otherwise, no need to eat anything. One thing. Yani the doctors give these instructions to the patient that don't eat anything before this procedure. Clear?
Yes.
And your stomach should be empty. In a patient's stomach should be quite, empty. One thing. Second thing is this, that if you or a patient, if a patient is using any kind of medicine, then stop that medicine and inform it to the doctor.
Any medicine, not
Any medicine. Any medicine, if you are taking, then before doing this procedure, inform your doctor that I'm using this medicine, and then the doctor will tell you that stop it before it. Clear?
Yeah.
Because before it, if you have a medicine in your stomach, if you have any other thing in your stomach, then the machine or this procedure, you can't see anything. You understand? Clear, Ikhwan?
Yeah.
Alright. So one thing is this, that I told you, that don't eat anything, don't take any medicine. If you're taking any medicine, then stop it and tell your doctor before it. Okay. If you need, then take only a few sips of water if you can. Right. So this is finished. That what preparations do I need before gastroscopy? Now the next step is usual condition after gastroscopy. Yes. Very important stage. Now when you have a gastroscopy process, what happens after this? This is a very important question. That what happens when after gastroscopy? What happens? This is a question.
We can't eat on
Yeah, you're right. He says that actually, normally you can go to your home after gastroscopy after some time.
Yeah, but don't drive, okay.
Yeah. You can go home after gastroscopy. Mostly people are able to go their home, or they can be in a good condition just after a few hours. 1 hour or 30 minutes like this one. They can be able to go back to their normal life. But sometimes if you are sedated means mukhaddarat.
Yes.
If you are in an influence of a medicine, then you have to stay more there
Yes. Because
before going back.
we don't have a normal life.
Exactly. You don't have normal life because you are under the influence of sedation. Okay? Then until the effects of sedation have gone off, don't go back to your normal life. Okay. Then stay there for some time, and there should be somebody who can accompany you, who can take you back to your home. There should be somebody who can
Anybody.
yeah, there should be somebody who can take you back to your home or anywhere. Clear? One thing. Second thing is this, that if you have a sedation, then until the effects have gone off, don't drive. Don't drive a car or any machinery. If you will do it, then the effects can be in bad condition. One thing. Second thing is this, that don't go back to your home. Oh yeah, I got it. Actually, don't drink alcohol for 24 hours after gastroscopy. Okay, so these are the things that usually usual conditions after gastroscopy. Actually, after gastroscopy, patients are told that if you have a sedation, then don't drive your car, don't drive any machinery, or stay there. There should be somebody who can take you back to your home, and don't take alcohol for 24 hours. And like this one, you have to be careful for these things, right? Okay. Now, the same things I have written here, that if sedative, don't drive, take somebody, accompany you to your home. Okay. Now, the question number next is here, is gastroscopy reliable? Reliable means dependable.
How do you spell it?
R-E-L-I-A-B-L-E, reliable. Reliable means trustworthy. Trustworthy. Yani sika. Yani this test is really a good test or not? Okay, is it reliable? So yes, this test is reliable. This test is a good test, right? Because mostly it gives you a good result. Mostly it gives you a good result, and it helps us to know the problems inside the stomach, right? But he says that this is not 100% dependable. 100% results cannot be taken from this one. Even sometimes it does not help us to know the early stages of cancer or early stages of ulcers. Sometimes, mostly it works very nicely. Mostly it gives you a good result, but not 100% all the time. Because in this condition, it does not help us to know the early stages of cancer or ulcer in your stomach. So it means that mostly this test is very nice, very successful. It gives you good results, but he says that sometimes it does not give you good results.
With the cancer?
Yes, sometimes it does not give you good results, and even sometimes the early, yani مراحل الأولى للسرطان أول درجة the first stages of cancer and ulcers are not detected here with the help of this process. Clear? So mostly this is very good result, but as I told you that sometimes it does not give you 100% result. Clear?
You can repeat it.
Okay, no problem. I'll do it again. He says that is gastroscopy reliable, trustable, trustworthy, dependable? Is it good one or not?
Reliable. What's mean?
Reliable means dependable. Now again, dependable.
توافق يعني في الإجراء هذا.
Dependable. Okay.
Dependable. What is the translation of this one in Arabic?
ثقة.
ثقة. Is this a good test for your problems in stomach? Okay. Actually, he says that this is a good test. This is a good test. This is a dependable. This is a reliable test, right? Because mostly it gives you good results. Because mostly it helps us to diagnose the problems inside the stomach sometimes. But he says that though it is a wonderful test, but sometimes it does not give you 100% result, because sometimes it does not help us to diagnose the early stages of cancer and ulcer. Okay, these are the problems in these problems can be in the stomach, and sometimes this test is not helping us to know the conditions there. So actually, that's why we say that it's a good test, but not 100% true.
Next point.
Yeah. Can you stop this mobile, akhi? Okay, now we have another one. The last point of this topic is that the complications related to the process of gastroscopy. Complications means difficulties, difficult conditions after the gastroscopy. What happens after gastroscopy related to complications, related to, other side effects.
Maybe half a pain.
Yes. You know side effects? Side effects means آثار الجانبية. Okay. بعد يعني عملية هذا ايش آثار الجانبية. Right. Once he says that actually mostly it is a good test and the people are able to go back to their normal life just within a few hours. But sometimes the patients can have some other problems. Okay. For example, when it goes from the passage of mouth to the stomach, it damages the gut.
Yeah. Here.
It damages the gut, and due to this damage condition, actually, what happens that it starts bleeding. Then bleeding comes out there. Okay, and then it can be infection after that. So infection can be, infection, adwa. Infection can be there. So this is one of the problems there, right? Then the other problems is that sometimes I think abdominal pain in your belly or patient's belly can be happen. Abdominal pain, right? Any pain in abdominal area can be possible. Maybe fever can be happen. Fever, fever. Fever can be possible, and after that vomiting can also be possible. Vomiting, yani yakra, what do you call it? Qara. Qurha. In Arabic, qurha yani vomiting. Okay, vomiting can be possible after this one, but it is not happening. Mostly, it happens. I think sometimes, right? Mostly, the patients are able to go back to their normal life after 1.5 hours mostly. But sometimes these problems can be possible. One is it can have fever after the gastroscopy. It can have abdominal pain. Abdominal pain can be possible after this one, and even after that, vomiting can be possible, and breathing in difficulty in breathing can be possible, right? So these problems can be possible after gastroscopy. Now, if we have these problems, and if they are staying up to 48 hours, then definitely a doctor should be consulted. If you find that these problems are, lingering on and continuing on and on, and they're not diminishing, they are not going back, they're not, disappearing, then it is essential that doctor or consultant should be consulted. Clear? But he says that sometimes, in a very rare chances, very shaz or nadir, it happens that even a patient can have a heart attack.
What?
Heart attack.
Heart attack.
Patient can have a heart attack and a stroke. Okay? And what do you call it in Arabic? Sakta qalbiya. Sakta qalbiya, mumkin. Possible. After this one, but these are not commonly happening. These things like heart attack or stroke, they are very, very rare. Okay? Not commonly happen to every patient here. But though it can be possibility. It can be possibility that these things can be happen there. Definitely he says that if you have these things like abdominal pain, if you have fever, vomiting or breathing difficulty, then, and if these things are not going or not disappearing, then it's important that you should talk to the doctor, should consult to the doctor, and then you can be, you can have a treatment for them. Clear? Akhwan, we have finished this one, right? these were the summary points of this unit, right?
Okay.
Any question if you want to ask now?
Yes.
Yes.
How do you spell it? This complication.
Complications.
How do you spell it?
COMPLI CATIONS. Complications related to the process of gastroscopy.
So the
Process. PROCESS.
This is number 5.
Number 5.
After down good.
This one?
Yes. This is
This one?
before. Yes.
Ulcer.
Spelling
ULCER.
CER.
Yes. But as I told you, there's no need to write these points. These are just for your understanding. It's a kind of summary that how can you understand. Clear?
Yes.
Now, any further question you have? Clear now, huh? Okay. Now let's start our work here. I'm going to read this passage 2-3 times, and then you just listen, and after that we can have other things. Okay, let's see. Okay? The first question is, please open your books now. What preparation do I need to do? What preparation do I need to do? The hospital department will usually give you instructions before you test. These commonly include, number 1, don't eat for 4 to 6 hours before the test. The stomach needs to be empty. Small sips of water. Sips means rishwa, small amount of water, okay? Small sips of water may be allowed up to 2 hours before the test. Right?
Right.
Yeah. Now, second, if you have a sedative. Sedative means influence of medicine. Musakkin or sleepy condition due to the drug. If you have a sedative, have somebody accompany you home. Accompany means somebody who can be with you to take you home back. If you are taking any other medication, tell your doctor. Medication means medicine. If you're taking any medicine, tell your doctor. Okay? It may need to be stopped before the test. It may need to be stopped. It is required that any medicine, if you are taking, it should be stopped before this test.
Okay.
Akhwan, clear?
Yes.
No problem, I think.
Yes.
And these were very, very easy. Okay, let's see. Now, what can I expect? Expect means tawakkul. Tawakkul. What can I expect after a gastroscopy? You know, what can be happen? What can be possible after gastroscopy? He says most people are ready. Most people are ready to go home after resting for half an hour or so. Yani for half an hour after, mostly people are ready to go to your home, to go back to their normal life. After resting for half an hour after gastroscopy, patients are quite capable to go back to their home. Okay. If you have had a sedative, you may take a bit longer to be ready to go home. If you have kind of influence of any medicine, then you can take some more time to get rest, and then you can be able to, even after that you can be able to go back. The sedative will normally make you feel quite pleasant and relaxed. Okay? However, you should not drive, operate machinery, or drink alcohol for 24 hours after having a sedative. If you have a sedative, and you know that when you have a sedation condition, then actually you feel relaxed, quite calm, and quite normal or pleasant actually. But even though you don't feel any pain or any kind of difficulty, but it is recommended that don't drive any car, don't drive any machinery, and don't take alcohol any further. You will need somebody to accompany you home and to stay with you for 24 hours until the effects have fully worn off. Then you have to be there for 24 hours. Then after that, when all the effects of medicine have gone, then you are quite normal. Then you can go back to your normal life. And then for this one, somebody should be there with you to take you back to your home or anywhere from where you come from. Most people are able to resume normal activities after 24 hours. After 24 hours, mostly people are able to resume, to restart. Resume means to restart again your activities of your life. Okay. Now another question is this one here. That is gastroscopy reliable, as we have written these points here. So he tells you that yes, gastroscopy is a good test. It's a good test. It's written there. Okay? Test for seeing abnormalities. Abnormalities means abnormal conditions of stomach. Abnormal, yani غير صحيح. Okay? Abnormal conditions in the upper gut. Upper gut means upper part of the stomach. Right? Yani ula. Okay? However, it is not foolproof. It is a very good test. It gives you good test results, and it helps us to know the abnormalities of the stomach, but it is not foolproof. It is not 100% good. It is not 100% effective to know the problems of the stomach inside. For example, gastroscopy may not detect means tashkhis or taftish, detect. For example, gastroscopy may not detect a small number, a very little number of cases of early ulcers or early cancers. You understand now? Sometimes gastroscopy, with the help of this procedure, early stages of cancer or ulcer are not detected.
What does ulcer mean?
Ulcer is a kind of sickness in your stomach. Okay, there is a pain. There's a pain inside, and you will see that it is maybe infection or wounded there. All the time you feel pain.
Yes.
All the time in your stomach you feel pain, and it is also a bad disease actually. A patient cannot eat anything. The patient cannot eat because there is a pain inside. And if he eats anything, then again I think there is a pain, and it does not digest it properly.
But there are differences between ulcer and cancer.
Yeah, mostly. Yeah, they are different. Ulcer is different than cancer. Cancer is saratan. Okay? You know, cancer is abnormal growth of cells or tissues. Right? Cancer is abnormal growth of tissues or cells there. Alright, now let's see. Gastroscopy is a reliable test. It gives you good result mostly, but sometimes it is not successful. It does not give you good result. Clear? Okay, let's start the next thing. Are there any side effects or complications from having a gastroscopy? Are there any side effects? Athar al-Janabiya after gastroscopy or not? He tells you, most gastroscopies are done without any problem. Mostly, when this process is carried out, there is no problem. Mostly, okay? Some people have a mild sore throat. Sore throat means, And there's a problem in your throat, mild sore throat for a day or so. Afterwards, you may feel tired or sleepy for several hours if you have a sedative. There is a slightly increased risk of developing a chest infection or pneumonia following a gastroscopy. So these are the side effects which I'm telling you, that basically when you have this process, you can have sore throat in your throat. One thing. I mean, you can have infection, chest infection, because the gut can be infected.
Cardiac.
Yes. Yeah, chest infection or cardiac problems maybe sometime.
Yes.
Then you can have a pneumonia. Pneumonia is also another problem, another disease. So it can be possible that after this you can have it. Okay. There is a slightly increased risk of developing a chest infection or pneumonia following a gastroscopy, meaning after gastroscopy. Now we have another one. Occasionally, the endoscope causes some damage to the gut. See, this may cause bleeding, infection, and rare perforation. Perforation means a hole, succum. Sometimes this pipe makes a succum. Succum means hole.
Yeah. Small hole.
Small hole in the surface of the stomach here. Sometimes it happens. Perforation, if any of the following occur within 48 hours after gastroscopy, consult a doctor immediately. Now these are the problems. If any one of them happens within 48 hours, then it's important that doctor should be consulted. Masala, abdominal pain. Any pain in abdominal area, fever, if the patient is having a fever, then it's important that the doctor should be consulted. Difficulty breathing. Sometimes person can have a problem in breathing actually, and then I think even it's really a critical condition. And vomiting blood. If the blood is coming out in
That means there are problems inside.
in vomiting, then consider that there is a problem inside. A small number of people have a heart attack. See, a small number of people, very few people can have a heart attack or stroke during or soon after a gastroscopy. Clear? Sometimes patients can have heart attack or stroke during this procedure or soon after this procedure. Heart attack. Okay. These serious complications are rare. Rare means nadir. These complications, these side effects are very, very rare. Okay. In most people who are otherwise reasonably healthy. Otherwise these people are very healthy, very, very effective there. Now we have finished this one. I have explained every part of this unit. I have explained all the, all the points here. Now, just I'm going to write the difficult words on the board. So please write here. Open your notebooks and start doing there.
Don't have time.
We don't have time? Okay, no problem. Then it's okay.